Treatment and management of Alzheimer disease. At present, there is no cure for this disease. Still, research is going on to get the final mode of treatment to eradicate this devastating disease. But there are various methods and medicines which are used to reduce the speed of the progression of the disease and the severity of the symptoms to give relief to the patient. Because it is a prolonged disease, neurodegeneration occurs in this disease, which is a prolonged period. It may extend from 10 to 30 years. Only the symptomatic treatment can be given because according to the more reliable theory, there is deficiency of the acetylcholine chemical which is responsible for the neurotransmission and conduction of the impulses across the neurons in the central nervous system. So, deficiency of the acetylcholine is maintained by the medicine. Then, according to the other findings like antihypertensive, antidiabetic, antihistaminic, antiviral medicines, especially the known factor that's herpes simplex virus number 1 is mostly responsible for Alzheimer disease as a risk factor because the virus travels along the nerve roots towards the central nervous system where it attacks the neurons and produces inflammatory process. Then there is inflammation is produced by the action of the immune system, so that can be recovered by the NSAID medicine therapy. So in addition to this, the patient's lifestyle has to be changed. Regular aerobic exercise, healthy diet, healthy weight is to be maintained, excess of water intake, the saturated fat and the red meat must be excluded from the diet. So these are the various steps, especially fresh foods and the antioxidant vitamins like vitamin E, vitamin C, vitamin K, vitamin D. They are necessary, must be added in the diet of the patient. So these are various steps by means of which we can reduce the velocity of the progression of the disease. And also you can reduce or minimize the intensity of the symptoms and the trouble of the patient. Rehabilitation processes like exercises can be employed and is soothing one. Adopt of various activities like hobbies must be important to the patient so that he get some relief and pleasure for his rest of the life. So these are the major things because there is no treatment, no medicine which is employed or used for eradication of this disease. So it is a aging disease. Mostly it occurs over the age of 60 years. So only the preventive measures and the maintenance and the management can be used for the control of the disease.